Bismillahirrahmanirrahim. Today we are going to discuss a condition in which the pituitary gland becomes underactive and there is decreased production and or sometimes lack of the pituitary hormones. We know that the pituitary gland is a very important gland and it secretes various hormones from the anterior pituitary gland as well as the hormones produced in the hypothalamus like ADH and oxytocin, and these are stored in the posterior pituitary gland, and when needed they are secreted. So lacking of hormones from the pituitary gland will cause serious problems. Now, by hypopituitarism, we means that under secretion of the pituitary hormones and sometimes total lack of the pituitary hormones. Now, the signs and symptoms of hypopituitarism mostly depend on which hormone is not properly secreted. But in some conditions in which the hood of the pituitary gland is uh, uh, involved, by that we mean if it is compressed uh, and it becomes shrink and doesn't produce any of the hormone or decreased amount of the hormones are secreted. So in that condition, when all the hormones produced by the pituitary gland, if they are under secreted and sometimes are totally lacking, this condition is known as the panhypopituitarism. Now, hypopituitarism or decreased secretion of the pituitary hormones may affect the anterior pituitary gland and it may also affect the posterior pituitary gland. Here, one important point that I want to mention, that at least if 25% of the anterior pituitary gland is active and if it can produce hormones, so hypopituitarism doesn't occur. So hypopituitarism will occur when 75% of the active cells that produce anterior pituitary hormones, if it is destroyed or damaged. Further, we know that the anterior pituitary gland produces growth hormone, adrenocorticotropic hormone, thyroid stimulating hormone, gonadotropins including FSH and LH. So prolactin to cause milk synthesis and milk secretion. So when the anterior pituitary gland is damaged and in panhypopituitarism, a deficiency of all of these hormones occur. And we know that these hormones, they are essential to life, to a normal life. Now, the hypopituitarism in the anterior pituitary gland may be primary or secondary. The primary hypopituitarism, by that we mean that the problem lies in the pituitary gland. Now, very rarely the problem may be congenital. By that we mean that by birth the pituitary gland is atrophic and it produces reduced hormones and sometimes lack of the anterior pituitary hormones. But this is a very rare condition. The most common condition is the acquired causes of the hypopituitarism, in which initially the anterior pituitary gland is normal, but later on due to some cause it becomes underactive and it doesn't produce the proper amount of the anterior pituitary hormones, and sometimes there may be a total lack of the hormones. So the primary hypopituitarism is when the problem lies in the anterior pituitary gland. We know that the anterior pituitary gland is under the control of the hypothalamus. And this is the hypothalamus that senses various changes in the body, for example, osmolarity, blood glucose level, and other conditions. And then this hypothalamus orders the pituitary gland to secrete hormones to maintain homeostasis. But sometimes if there is a problem in the hypothalamus, for example, a tumor or a disease, injury that involve the hypothalamus, it will be unable to release the releasing factors that are important to order the anterior pituitary gland to produce various hormones. So in this situation, the underactive pituitary gland and the pituitary gland that doesn't produce the proper amount of the hormones needed by the body, it is not due to a problem in the anterior pituitary gland, but the problem lies here in the hypothalamus. And in this condition, we will call this type of hypopituitarism as the hypopituitarism of hypothalamic origin. And we call this as the secondary hypopituitarism, because the problem lies here in the hypothalamus that is not producing the proper releasing factors to order the anterior pituitary to cause uh, secretion of the pituitary hormones. We know that the posterior pituitary gland itself doesn't produce hormones, but the two important hormones, the antidiuretic hormone or ADH and the oxytocin, they are produced in the supraoptic and paraventricular nuclei of the hypothalamus, and they are just stored in the posterior pituitary gland. And when needed, they are secreted. So hypopituitarism in the posterior pituitary gland is almost hypothalamic in origin. And the most important uh, condition that will arise from the hypopituitarism in the caused by damage to the posterior pituitary or hypothalamus is the diabetes insipidus, because the hypothalamus is unable to produce the antidiuretic hormone or vasopressin, and the body is unable to reabsorb water, uh, the renal reabsorption of water that is under the control of antidiuretic hormone, and the patient will pass excess amounts of urine, just like that what happens in diabetes mellitus, and therefore it has got its name is the diabetes insipidus. We know that the ADH and oxytocin, they are produced in the hypothalamus. So posterior pituitary gland, the hypopituitarism associated with the posterior pituitary gland is always hypothalamic in origin. Now, we can't do anything if there is congenital hypopituitarism, and if the pituitary gland doesn't produce the proper amount of the hormones by birth. But we will discuss the acquired causes of hypopituitarism. By that we mean that the pituitary gland was totally normal, but due to the mentioned causes, later on it became underactive and started to not to produce the proper amount of the hormones, and sometimes there may be a total lack of the hormones. So the causes of the hypopituitarism includes the number one and most common cause is the compression. By compression we mean that if the pituitary gland is persistently compressed or pressurized, what will happen that the cells, various populations of cells, the trop cells, they will undergo atrophy and become necrotic and unable to produce hormones. So compression is the most common cause, and mostly it is caused by an adenoma. An adenoma that develops in the anterior pituitary gland, it will compress the normal pituitary gland, and ultimately the normal and hormone secreting cells, they will become atrophic and will undergo necrosis. The most common cause in adults is an adenoma, which is a benign tumor that arises in the anterior pituitary gland, and that may be functional, producing hormones, and sometimes non-functional, that will produce only the mass effect and compressing the normal hormone producing cells of the anterior pituitary gland. In children, the most common cause is craniopharyngioma. This is a tumor that occurs in children, and this craniopharyngioma develops from an embryonic structure known as the Rathke's pouch. This structure, the Rathke's pouch, in embryonic life, it will give rise to the pituitary gland. It will give rise to the formation of pituitary gland, and sometimes cancer appear in the Rathke pouch, and this type of cancer is known as the craniopharyngioma, and it will suppress the pituitary gland, and the hormone secreting cells will ultimately become atrophic and undergo necrotic cell death. So compression is the most common cause. Sometimes cerebrospinal fluid accumulates in the sella turcica, and it will be having the same effect as the compression. It will be pushing the pituitary gland, and under the compression or high pressure that is exerted by the presence of cerebrospinal fluid in the sella turcica, where the pituitary gland is located, it will cause the shrinkage and necrotic death of the anterior pituitary cells, and sometimes the pituitary gland is so much compressed that it appears flattened to the wall of the sella turcica and cannot be very easily visualized. It becomes flattened to the wall of the sella turcica, and this is known as the empty sella turcica, because here the gland is so much shrinked and compressed that it becomes flattened to the bones, and the sella turcica appears empty. This condition is known as the empty sella turcica, and this condition can also be caused by the cerebrospinal fluid accumulation and the pressure and compression exerted by the cerebrospinal fluid. The third common cause of pituitary hypopituitarism is the pituitary apoplexy. What happens that the pituitary gland has a limited blood supply from the hypothalamic pituitary hypophyseal circulation, which is a portal circulation. Now, if a tumor develops in the pituitary gland, and if it is a growing tumor, progressive tumor, it will demand more and more blood. So what happens that the pressure in the blood vessels that supply blood to the tumor, it will be increased, and increased pressure are a type of hypertension of the vessels that supply the tumor in the anterior pituitary gland. The vessels, they are susceptible to rupture, and when a vessel within a tumor is ruptured, it will lead to hemorrhages, bleeding here, and after the rupture of the vessel, the rest of the pituitary gland is deprived of the blood and oxygen, and what will happen that the hemorrhage and ischemia, it will cause death of the normal and hormone secreting pituitary cells, and this condition is known as the pituitary apoplexy. And if bleeding occurs within a tumor, this will make a neurosurgical emergency, because accumulating blood is lethal, and if not treated in time, and if it is severe, it can cause death of the person. The fourth cause of hypopituitarism is the Sheehan syndrome. Sheehan syndrome, we discuss it in the next slide in detail. Sometimes the hypopituitarism may be caused by iatrogenic causes. Iatrogenic means that we induce medically or surgically a problem in an organ. And this type of situation is commonly seen during neurosurgery, or sometimes if we are doing radiation therapy for some purpose. During neurosurgery, the pituitary gland is unintentionally damaged, and ultimately it will lead to hypopituitarism. Similarly, if we are doing radiation therapy for some purpose, we may unintentionally damage the pituitary gland, and it will also lead to later on to hypopituitarism. Disseminated intravascular coagulation is a condition in which multiple thrombi are formed within the blood vessels, and this type of condition we have discussed while discussing the septic shock, and it can occur in so many other conditions, but the excess formation of multiple thrombi within the vascular system may block blood vessels, and this type of damage may include pituitary gland, and lack of blood supply will deprive the pituitary gland of oxygen and blood, and the cells in the pituitary gland may undergo ischemic necrotic cell death. Sometimes inflammatory diseases, for example tuberculosis and sarcoidosis, they may occur in the pituitary gland, and they can also cause hypopituitarism. If a tumor get metastasized and get lodged as a secondary in the pituitary gland and starts growing here, it may compress and damage the hormone secreting normal pituitary cells and can lead to hypopituitarism. Sometimes traumatic injuries like head injury may cause damage and destruction of the pituitary gland or sella turcica, and it will also result in hypopituitarism. Shock in which there is a systemic hypoperfusion of the tissues and systemic hypotension, the same may affect the pituitary gland, and when it is deprived of the blood and oxygen, it may undergo ischemic necrotic cell death, and finally the hypopituitarism. Hypopituitarism, it may be caused by the conditions that we discussed in the previous slide whatsoever, but when the pituitary gland becomes underactive and if it is not producing the proper amount of hormones needed by the body, it will lead to many problems. Mostly the luteinizing hormone, follicular stimulating hormone, and growth hormone. The signs and symptoms of the deficiency of these hormones appear very early as compared to the thyroid stimulating hormone and adrenocorticotropic hormone. The symptoms and signs associated with lack of these hormones comparatively appear later. Lack of the gonadotropins, the luteinizing hormone, and follicular stimulating hormones will have different effects in male and female. We know that the gonadotropins are essential for stimulating the ovaries in female and testicular tissue in the male. Here they lead to the production of the female hormones estrogen and progesterone, and in male they are essential for the production of the testosterone, which is the male sex hormones. So when there is lack of the gonadotropins in female, what will happen that the female may develop oligomenorrhea, decreased menstrual blood, and sometimes if the condition is severe and if the deficiency of the gonadotropins is severe, there may be total lack of the menstrual periods, and this condition we call amenorrhea, total lack of the menstrual periods. And we know that when there is no menstruation, no regular menstrual periods, there will be no ovulation, and infertility will be an issue to those females. In males, the lack of testosterone may lead to sexual problems, and there may be loss of pubic hair, and since testosterone has got role uh, in making the muscle mass, so the male may suffer from reduction in the muscle mass. Now coming to the growth hormone, we know that growth hormone is very important for the growth, particularly in children. So when there is a lack of growth hormone, what will happen that the person may be having a lean body mass, because growth hormone is important for the development of the muscles, as it increases the nitrogen and amino acid uh, that are taken by the muscles for the synthesis of proteins, and that make the muscle mass. Similarly, in addition to the lean body mass of a person, the growth hormone is also important because it stimulates the osteoblasts. And we know that the osteoblasts are essential for the synthesis of bones. So, when the growth hormone is lacking, there will be no stimulation of the osteoblast, and the person may suffer from low bone density, particularly in adults. And as we know that growth hormone and insulin-like growth factor that is produced under the effect of growth hormone by various body organs, if the growth hormone is lacking, what will happen that there will be no growth of bones and other body tissues in children, and they will suffer from growth hormone deficiency, and so many problems that are associated with the deficiency or lack of the growth hormone as well as insulin like growth factor. In adolescents, growing children, when there is no growth hormone, there will be no growth spurt, and they will develop very delayed puberty, which normally occurs around the teen years, particularly the 14, 15, and 16 years. So, if there is no growth hormone, there will be no growth spurt, and this will lead to delayed puberty in adolescents. Now, coming to the TSH and ACTH, the signs and symptoms of which appear comparatively later than LHFSH and growth hormone. So, the lack of ACTH, adrenocorticotropic hormone, will lead to adrenal insufficiency. And we know that the ACTH stimulates the adrenal glands to produce cortisol, which is important component of the uh, response, particularly in times of stress, and which also increases the blood glucose level. So, lack of ACTH may lead to adrenal insufficiency, a condition known as the Addison disease, and it is a very serious problem, and that may lead to serious complications. We know that the thyroid stimulating hormones stimulate the thyroid gland to produce thyroid hormones like thyroxine T4 and triiodothyronine T3. So these hormones are very important for maintaining the basal metabolic rate. And if there is a lack of TSH, there will be no production or decreased production of the T3 and T4, and the basal metabolic rate will fall, and it will give rise to associated complications. Now we come to a rare but important cause of hypopituitarism, and that is Sheehan syndrome. Sheehan syndrome occurs in females, and particularly those females that have given birth to a child. In this condition, also the hypopituitarism is caused by a lack of blood supply and oxygen. The pituitary gland is deprived of its blood supply and oxygen, and it undergoes atrophy and ischemic necrotic death. So this disorder, the Sheehan syndrome, it will occur in a new mother who have given birth to a child, and it appears after delivery in the post partal period, when the cells in the pituitary gland starts to die due to as they are deprived of the blood and oxygen, and this commonly occurs due to postpartum or postpartal hemorrhages, bleeding after the delivery, that is known as the postpartum hemorrhage. And this postpartum hemorrhage will lead to pituitary ischemia and infarction, a condition that will lead to pituitary apoplexy. And the basic problem is that pituitary gland, in the postpartum hemorrhage, so much blood is lost that the pituitary gland, which itself has got a limited blood supply, when the blood is lost in postpartum hemorrhage, the pituitary gland will get deprived of the blood and oxygen, and it will lead to hypopituitarism. Now, the underlying mechanism is that during pregnancy we need prolactin to prepare milk for the new coming baby. And we know that prolactin is secreted from the lactotrophs cells of the pituitary gland. So during pregnancy and preparation for milk synthesis and secretions, the lactotroph cells that increase in size and number and grow. As these cells grow, their demand for blood is increased. But the blood supply to the pituitary gland doesn't fulfill this demand, and the blood supply is as like as it was before. So there is no compensatory increase in blood supply to the pituitary gland. So what happens that the growth and increase in size and number of the lactotrophs doesn't get the required blood supply, and we can say that they are at this stage, they are at risk of ischemia, and if severe ischemia, they are also at risk of ischemic cell death or necrosis. So we can say that the blood supply to the lactotrophs and rest of the pituitary cells is merely to keep it functional, and they can't withstand further loss of blood. The blood supply is just enough to keep them live and functional. But there is no compensation if the blood supply is reduced further. And this type of situation occurs if there is severe bleeding in the postpartum period. And the postpartum hemorrhage will cause the lactotrophs to die, as well as other cells producing other trop cells in the anterior pituitary gland. They will undergo ischemic necrosis and cell death, and this will lead to hypopituitarism. Normally, how do we define postpartum hemorrhage? The bleeding that occurs after delivery. If in a normal vaginal delivery, when a child is born through the normal birth canal, here if the blood loss is more than 500 milliliter, we call this as postpartum hemorrhage. In a patient in which the child is delivered through surgical procedure, opening the abdomen and delivering the child, and since this is a surgical procedure, here the blood loss is more. Here we define postpartum hemorrhage as loss of more than 1000 milliliter of blood. So in normal vaginal delivery, more than 500 milliliter blood loss, and in cesarean section, loss of more than 1000 milliliter of blood is called postpartum hemorrhage. Now, as we mentioned in the previous slide, that the pituitary gland is merely getting blood to remain live, healthy, and functional, and they can't tolerate further loss of blood. So what happens that if postpartum hemorrhage occurs, the blood supply to the pituitary is further diminished and decreased, and they are already susceptible to ischemic necrosis. What happens that the cells of the anterior pituitary gland, they die, they undergo ischemic necrotic cell death, and the pituitary gland becomes shrunken and flattened to the bone of the sella turcica, and the condition of uh, empty sella turcica develops, in which the sella turcica appears to be empty, and it is just like that it is lacking the pituitary gland, and it will lead to severe hypopituitarism. Now, the condition varies from patient to patient. In some patient, the production of the hormone is decreased. The underproduction may be more prominent for one or more hormones, and sometimes panhypopituitarism develops and all the hormones they are lacking. So, summarizing the Sheehan syndrome, we know that the pituitary gland is getting blood through hypothalamic hypophyseal portal circulation. During pregnancy, the pituitary gland enlarged due to hyperplasia of T lactotrophs and mammotroph cells. Their demand for blood is increased, but in fact, there is no compensatory increase in blood supply. They are susceptible to ischemia, and if after delivery severe bleeding occurs, if severe hemorrhage occur, it will lead to hypotension, and the pituitary gland is deprived of the blood and oxygen, and the trop cells undergo ischemic necrotic cell death in the postpartum period, and this will lead to severe hypopituitarism. Now, the effects of hypopituitarism depends on which hormone is lacking, and if there is a lack of one hormone or more hormones. So hypopituitarism will lead to failure of growth in children if the growth hormone is lacking. And we know that growth hormone causes lipolysis, breakdown of fats. So what will happen? That there will be accumulation of fat. We also know that growth hormone increases muscle mass by increasing the uptake of amino acids for the synthesis of proteins. So there will be reduced muscle mass. We also know that growth hormone is important for stimulating the osteoblasts to lay down bones, so there will be thinning of bones, and as a result there will be decreased or reduced energy and uh, low quality of life in adults, and failure of growth or dwarfism in children. The deficiency of the gonadotropins FSH and LH. If the condition is in a postmenopausal woman where the menstrual periods stop, so lack of FSH and LH will not be so prominent and will not be so problematic if the woman is the postmenopausal period. But before menopause, when a woman is having active sexual life, and if hypopituitarism occurs, what will happen? That lacking gonadotropins, the female patient will develop loss of menses or amenorrhea. It will lead to issues of infertility and also to loss of some female sexual characteristics. In men, the lack of the gonadotropins will lead to decreased production or total lack of testosterone, and uh, there will be testicular atrophy, and some male sexual characteristics may be lost. Thyroid stimulating hormone deficiency will lead to failure of stimulating the thyroid gland to produce thyroid hormones, and the patient will develop hypothyroidism, which is a condition associated with under secretion of the thyroid hormones like T3 and T4. And the hypothyroidism will be associated with its uh, effects like constipation, intolerance to cold, weight gain, and seriously decreased basal metabolic rate. The deficiency of adrenocorticotropic hormone may produce a very serious condition in which there is adrenal failure, no secretion of cortisol, which is a hormone that is uh, included in along with adrenaline and other hormones as a response to rapid response to stress, and ACTH deficiency or total lack will be the most serious condition, and it can be lethal because it will give rise to the adrenal insufficiency known as the Addison disease. Similarly, when there is no prolactin, there will be no growth of the mammary glands and milk production, and the patient will suffer from agalacturia. Melanocyte stimulating hormone, which is responsible for stimulating the melanocytes and cause pigmentation, which gives protection against ultraviolet light, and which is responsible for the particular color of the human skin. When the melanocyte stimulating hormone is lacking, the patient skin and color will be pale. Now, how do we diagnose hypopituitarism? To assess the hormone levels, we will measure growth hormone as well as insulin like growth factor 1. We will measure the gonadotropin level, we will measure the prolactin level, and we will measure thyroid stimulating hormone and adrenocorticotropic hormones. And for this, we will do certain tests in which we stimulate the pituitary gland by uh, cortisol, and if there is no response, this means that the pituitary gland is not producing ACTH. And we also do the ACTH stimulation test and insulin hypoglycemia test, in which we induce hypoglycemia by giving insulin, and we see that either there is an increase in ACTH or not. And if there is no increase in ACTH, this means that the ACTH is not produced by the anterior pituitary gland, and the patient suffers from hypopituitarism. Now, for the assessment of the tumor and size of the pituitary gland, we do imaging techniques like X-rays, computer tomography, and magnetic resonance imaging, and to see for bony and skull injuries. And we may also exclude some other conditions that may also give rise to similar symptoms seen in hypopituitarism, particularly the anorexia nervosa, which is a psychological problem in which the patient refuses to eat something, but the problem is purely psychological and not due to hypopituitarism, and the liver cirrhosis, which may also produce symptoms like that what we see in hypopituitarism. Now, the treatment of the hypopituitarism depends on the cause. If there is a tumor that is compressing the pituitary gland, if there is increased CSF pressure that is compressing the pituitary gland, so uh, if these conditions are treated in a proper time, the patient may get relief. However, once the pituitary has become necrotic and atrophic, and it has stopped producing the pituitary hormones, so we are left with no option other than to give hormones for the lifetime to the patient, and this is essential for life. So there is a summary of the anterior pituitary gland disorders that we have discussed. Prolactinoma is a prolactin producing tumor, give rise to amenorrhea, galacturia, loss of libido in both sexes, and infertility issues. Growth hormone excess will cause gigantism in children and acromegaly in adults, and due to elevated blood glucose level and insulin resistant, it may give rise to diabetes mellitus. The corticotropsil adenoma will cause Cushing syndrome due to excess secretion of the cortisol, and due to excess secretion of the melanocyte stimulating hormone, it may cause black spots or blackening of the skin known as the hyperpigmentation due to excessive stimulation of the melanocytes. And all pituitary adenomas, particularly those that are non-functioning, that are not producing hormones, they will produce mass effects like disturbances of vision, and uh, as we have mentioned, bilateral temporal hemianopsia, and uh, compression of the meninges that will cause severe pain, and the tumor will suppress the normal hormone secreting cells of the pituitary gland, and it will lead to hypopituitarism. Thank you very much.